You call me a saint, but you know I'm a stranger, all willing and able to do what you want. You think I'm a thinker, but I'm just a singer, all busy and pretty.
But today I'm not going to be talking about my personal story with disordered eating. However, it is partly the inspiration for this talk. But the other inspiration is my clients who I've been practicing for about 2 years now, and it's very common for people to come in to see me with the goal to lose weight. That's their primary goal, but they've got all these other things going on, and a lot of it is related to nutrient deprivation. And that's because when we restrict our calories, we are restricting our nutrients. And I hope that I can teach you a bit about today how some nutrient deficiencies can actually lead to modern illnesses that we are so familiar with today. So I want you to meet a typical client of mine. Her name is Jane. So Jane's main goal is to lose weight. She is an expert dieter and she knows the calories in everything. She reports a very long history of low-fat dieting. That's how she was brought up by her parents, trying to be healthy. But Jane is overweight, and she's not really sure why. She was also told by her doctor that she has pre-diabetes, and she doesn't really know what that means or what she should do, but her doctor told her just to monitor it. She also says in passing that she has a history of anxiety and depression. Two things that are very, very common, but not a lot of my clients tell me about this until the end of the consult because they don't think it has anything to do with nutrition. Jane also tells me about her family history of illness and disease, and she says that her mother has osteoporosis, and she's had multiple falls and fractures, and has been bedridden for long periods of time. And Jane really doesn't want to end up like her mother, so she's popping a lot of calcium tablets to prevent osteoporosis. It's not like Jane isn't trying. As I said, she's on a low-fat diet, but she also goes to the gym 3 days a week. But she can't go any more than that because when she's there, she gets really bad fatigue and weakness and muscle cramps. And this can last for 24 hours after she exercises as well. Jane has very, very high stress levels. She's got a family at home, a high-stress job. Jane's really, really on. And she also says that she gets sick a lot, which is extremely annoying if you have a busy life. She doesn't sleep very well. She gets less than 6 hours of sleep a night. And she says even though she's exhausted, she's wired when she's trying to get to sleep. And unfortunately, this is very, very common. She also says that she's got some dry skin, she's noticing a bit of hair loss, a bit of joint pain. These are things she's putting down to aging, but Jane isn't really that old. And she does admit to be fearful of eating fat. So restricting your calories is a little bit different to actually having a genuine fear of eating fat, and so many people share this same fear. So like all my clients and being a dietitian, I ask my patients what they are eating. So this is what Jane eats in a day. She starts her day with a skim flat white before work, and then she has 3 rice cakes with marmalade. At morning tea, she has a fruit salad, and then at lunch, she has wholemeal bread in a sandwich, a salad sandwich, and that's Nuttalex, not butter. And she has that with a herbal tea. Come 4 o'clock, she's finished work and she's starving. She needs something to pick herself up, so she has a small low-fat muffin. And then for dinner, Jane tells me she's trying to be mostly plant-based because fish and meat and eggs, they have a lot of fat. So she just has a nice big salad. And then before she goes to bed, she has a biscuit. So does this look like starvation to you guys? This is a typical healthy diet, quote unquote healthy diet. And this is what a lot of people are eating. A lot of people who are dealing with excess body fat, they're walking around and they're wondering, why can't I lose weight? To me, this is definitely starvation. And I'll tell you a few problems with Jane's diet that I've identified, and none of them have anything to do with carbohydrate. So as I said, I asked the question, and I want you to think about this a little bit as we go through the slides, but think about how much of today's illness and disease is a result of a nutrient deficiency. So maybe flip the focus onto what we aren't getting, and not so much about what maybe we're getting too much of. So just looking at Jane's diet, I can see that she's definitely not getting enough protein. Jane's hardly getting any protein at all. And when you're so focused on calories, you don't really think about what you do need, and you don't think about the difference between protein, fat, and carbohydrate. You just are trying to lower those calories, and that's clearly what Jane has been doing. So next to no protein, which is pretty scary. And then Jane's also not getting really any omega-3 fats. So the long-chain omega-3 fats that are absolutely essential in our diets come from marine sources and then also from pasture-raised meats and pasture-raised eggs. And Jane's avoiding those foods. She's avoiding fat because she doesn't want to put on weight. And she doesn't even know there's such a thing as essential fats. And then magnesium. So Jane's really surprised that she's low in magnesium because she's having a lot of fruit, a lot of vegetables. She thinks she's getting all that she needs. And even though magnesium is in a lot of foods that Jane's eating, Jane needs a lot more than the average person. And I'll tell you why in a minute. So why should we care about not getting enough protein? Protein deficiency can lead to hair loss and hair thinning. A lot of women deal with hair loss, and especially when they're going on their diets to try and lose weight, and they kind of just put up with it. This is something Jane said she was experiencing. Brittle nails is another one. Red, flaky skin is very common in older adults, but is it because they're getting old, or is it because they're not eating as much protein? Reduced sleep duration can also happen when you're not eating enough protein, and that's because a type of protein called tryptophan is required to make serotonin, and then serotonin is required to make melatonin, and melatonin helps us fall asleep. So not having enough protein can literally keep you wired at night or make your sleep duration shorter. Not having enough protein can increase your risk of bone fractures. So this was something Jane was very worried about, and she was taking a lot of calcium. That's all she was thinking about when it comes to her bone health. But if you're not having enough protein, you're going to end up with a lower bone mineral density. So that's important too. Another thing Jane mentioned to us was that she gets sick a lot. And so again, people don't relate this to diet. But protein is required to make all those cells that fight off infections and heal your body. Your body doesn't make them out of thin air. We need protein to give our body the building blocks for those immune cells. And really severe protein malnutrition can actually lead to fatty liver and edema. These are also very common in our society. So that's protein. Is anyone surprised? We know it's pretty important. So we know we need to get protein in every day, but as I say, it's very common when you're dieting to forget about that. So what about long-chain omega-3 fats? If we're not having enough of these fats, we can get dry, scaly skin, just like a fish, and that's the best source of omega-3s. Dermatitis can also be caused or exacerbated by a long-chain omega-3 fat deficiency, and this is something people definitely don't think has any relationship to diet. So because long-chain omega-3 fats are anti-inflammatory, a deficiency can leave you in a bit of a pro-inflammatory state. And inflammation is said to be the root cause behind many of today's illnesses and disease. Research also tells us that lower intakes of these types of fats will also increase your risk of insulin resistance, type 2 diabetes, heart disease, depression, cognitive impairment, and Alzheimer's disease. So this is pretty important. And You don't want to get Alzheimer's when you're 70, 80, or 90. Can you do anything about it now to prevent it? And what about magnesium? So we said that Jane needs more magnesium than the average person. And the main thing that makes me think of this is because Jane is under a lot of stress. And stress depletes your body's stores of magnesium. Your body is using up magnesium and other electrolytes in times of stress. So we need to replace those magnesium losses. Otherwise, we can face a deficiency. A lack of magnesium can lead to muscle cramps, which is what a lot of people take magnesium before, but they don't realize it has other important roles in the body. A really severe magnesium deficiency can also cause numbness and tingling in your hands and feet. That's also very common, particularly in people with diabetes. Because magnesium is essential to make ATP, which is our energy molecule, we will have low energy if we're deficient in magnesium. A lot of people even go on a low carbohydrate diet and they don't find they're getting that energy boost that they thought they would experience, and sometimes it could be related to magnesium. A lack of magnesium can also lead to poor sleep because just like in a muscle cramp where we need magnesium to help turn the muscle off and let it relax, we need that for our whole body and for our brain as well. So if you've got a racing mind and you're struggling to fall asleep, maybe it's a magnesium deficiency. And then if you're not getting enough magnesium, and you may or may not have had your magnesium tested in the blood before, you'll probably see that your magnesium levels in the blood are normal, and it's very rare to have low magnesium in the blood. The reason is because your body will just take magnesium from your bones. So if you're low in magnesium, your body will take it from the bones and put it in the blood. That's not a good thing. It can increase your risk of osteoporosis. And there's a lot of research into the role of magnesium in insulin sensitivity. It's said that a lot of cases of type 2 diabetes are actually caused by a magnesium deficiency. So it's very, very important. So Jane goes and gets some blood tests as well, which are quite helpful. I'm not sure how much you can see, but the top result is her vitamin D. So her most recent vitamin D is 47, which has come up as low. But it's not like Jane's just become low in the past couple of months. If you can see back to 2017, her vitamin D was 59. So there's no L next to that vitamin D, but it still doesn't mean she's sufficient in vitamin D. She's very, very close to the lower end of the normal range. And I would say based on her symptoms, Jane's been deficient in vitamin D for a very long time. And then the second result is vitamin B12. So Jane's vitamin B12 now is 399. It's still above the lower end of the reference range. But if we look back into 2013, her vitamin B12 was double. So I'm getting concerned. We ran a secondary test for her B vitamin status because serum B12 isn't really that great an indicator, and it's her homocysteine level. So homocysteine is in range, but it still indicates that she's not using her B vitamins efficiently. So just because something's in range doesn't mean that it's optimal. So why should we care about our vitamin D status? Jane just wants to lose weight. She doesn't really care what her vitamin D is. But low vitamin D can lead to those low energy levels she was experiencing. And your body needs energy to burn energy, right? So if you want to burn stored body fat, you need to make sure you have enough vitamin D to do so. Low vitamin D is also associated with low mood and depression. So depression is another thing that Jane didn't think was related to diet. But what if we could boost up her vitamin D and see what effect that had on her mood? Low vitamin D can also increase pain perception and even inflammation. This is very important for our chronic pain patients. And a lot of patients who say they have chronic pain have never had their vitamin D levels tested. And I definitely think it's something that could contribute. Low vitamin D can also increase risk for type 1 diabetes, and there's a lot of research going into the mechanism behind why this might be the case. And vitamin D is really important to reduce your risk of some of those other diseases you can see on the screen. So you can see how these vitamins and minerals are relating to modern health. And with vitamin B12, this is another one that's very common to be low in, and it's really, really hard to catch a vitamin B12 deficiency. So I don't think we should wait until people become deficient. I think we should be looking for vitamin B12 in the diet and checking people's signs and symptoms to make sure they're not even heading in the direction of being low. Because vitamin B12 can lead to a lot of these things on the screen. But one thing I want to highlight is that vitamin B12 helps to make the myelin sheath around all of your nerves. So that's like the cushion around your nerves. And you can imagine if you're not getting enough vitamin B12 and you're deficient, that myelin sheath can actually start to break down. So your nerves don't function as efficiently. So you can see how that can relate to things like peripheral neuropathy, which is pain in the hands and the feet. It can even lead to loss of vision, blindness, difficulty balancing, which is very, very common, and even dementia. So by the time you're diagnosed with dementia, are you going to know that it was vitamin B12? And do we wait until people have a deficiency? Or do we try to treat this well before it even happens? And maybe we could prevent some of these diseases. Do the foods on the screen that I've been showing you look familiar? Because a lot of the foods that you can find these vitamins and minerals are foods that we naturally eat more of on a lower carb, higher fat diet. But not all low carb diets are created equal. On the left, we've got a low carb salad, but you can clearly see there's not a lot of protein, there's not a lot of fat, and there's pretty much no B12, no vitamin D, nothing we can really see, maybe just a touch of magnesium in those green leafy veggies. But on the right, we've got a far more balanced, I suppose, or more well-formulated low-carb diet that's hitting on a lot more of those micronutrients. So it might look like an increase in food, and some of you might be thinking, but if I'm trying to lose weight, how can eating more food help me? But hopefully, because you can see the nutrient density in the diet on the right, and you can see how we can manage and treat some of those conditions which are really preventing people from being able to lose weight and reach better health. So just a couple of tips for boosting micronutrient density. The first step is to prioritize protein. And I mentioned this a little bit earlier, protein is very, very important. And protein from animal food sources, you probably saw as we were going through the slides, a lot of those rich sources of the vitamins and minerals we need that a lot of people are lacking in are from animal proteins. So you can get them if you're including those in your diet. Do not fear fat. Fat can really help us absorb the nutrients from food. And if you vary the different types of your fats in your diet, you get different forms of fat-soluble vitamins in the different types of fats. So fat is extremely important too. And get some support. If you think you are deficient in a vitamin or a mineral, or you identify that your patients might be at risk, get someone who can look at the whole picture and look at signs, symptoms, and be able to interpret blood tests. And then, of course, look at diet. Because blood tests don't always show the whole picture. And I always like to prioritize the symptoms and the things people are telling me they experience, because they're the most important things, right? So I'll leave you with some food for thought. Our body knows how to heal itself, but we are responsible for providing the raw materials to allow it to do so. Thanks.
Thank you, Jessica.